Okay, let's talk about the causes and the prevalence of anxiety disorder. So first, let's talk about the prevalence. There is a wide variety of anxiety disorders, and they differ by the situations and the objects that induce them. But let's start with adults. So this data is going to be based on a diagnostic interview data from the National Morbidity Study Replication. All right, this involves U.S. adults aged 18 or older. So this is adults 18 or older in the United States. So in the past year, an estimated 19.1% of U.S. adults had an anxiety disorder. The prevalence in an anxiety disorder was a lot higher with females than for males. For females, it was 23.4% and 14.3%. And I will include graphs to all of this data from this study in my slides, so feel free to go through and look at that. An estimated 31.1% of U.S. adults experience any anxiety disorder at some time in their life. So that is a pretty high prevalence rate. And I've looked at a couple, while I was doing my research, I did look at a couple of different studies and data. They did differ slightly, so I just want to put that out there. They did differ slightly, but they were painting a very similar picture. So in the past year, 19.1% overall of U.S. adults suffered some sort of anxiety disorder. For adults 18 to 29, it was 22.3%. It was 22.7% for adults aged 30 to 44, and then it went down from there. So 20.6% ages 45 to 59, and for people 60 plus, it was 9%. So a pretty big drop off for the age group of adults 60 plus. Now let's talk about the severity of these past year anxiety disorders, because again, it's gonna differ. So 43.5% suffered from a mild anxiety disorder, 33.7% suffered from a moderate disorder, and 22.8% suffered from a serious disorder. All right, so that's how many adults have suffered from it. And again, the study was done in the data from 2001 to 2003. So just keep that in mind. Now let's go among adolescents. And looking at the adolescents, as you will see in the graphs, it is much higher among adolescents. And I know from personal experience and from a lot of people I've talked to, the most anxiety that they have suffered from has been when they were an adolescent, when they were a teenager, probably in high school and around that age range. It seems to be when a lot of people suffer some sort of anxiety, and a lot of people suffer from anxiety disorders. So adolescents, 31.9% suffered some sort of anxiety disorder. And again, these are ranging from mild to severe. 8.3% suffered with severe impairment. And we're still seeing females suffering from males at a way higher rate among adolescents. 38% for females, 26.1% for males. So again, that's affecting a lot of people. Now, let's talk about the treatment we have here. Let's talk about the causes. So how are anxiety disorders caused? So the causes for anxiety disorders are still not fully understood. Life experiences and traumatic events appear to trigger anxiety disorders. I do have a student in my class who suffers from an anxiety disorder, and her home life is not the best. It's not what it should be for a child her age. Parents divorced. There seems to be some drug use among members of her family. Lots of siblings, and I know. And on our parent survey, her stepmother said some very bad things about her that no parent should say about her child. So she is suffering at home. She sometimes comes in with dirty clothes, says things that her parents let her do that most parents would not let a child her age do. So I do believe that her home life and these traumatic experiences led to an anxiety disorder. Also, the life experiences and traumatic events, they especially appear to trigger anxiety disorders in people who are already prone to anxiety, and inherited traits can also be a factor. So genetics may also play a factor. There's medical causes. So for some people, anxiety can be linked to some sort of underlying health issue. And anxiety signs and symptoms, in some cases, can be first indicators of a medical illness. So let's go through some examples of medical problems that can be linked to anxiety disorder. The first one is heart disease, and I do know of a family friend who suffered from heart disease, and because of that, a anxiety disorder did develop. Some other examples are diabetes, thyroid problems, respiratory disorders, drug misuse or withdrawal from alcohol or anti-anxiety medications, other medications, chronic pain or irritable bowel syndrome, and rare tumors that produce certain fight or flight hormones can also. Sometimes anxiety can be a side effect of certain medications. So it's possible that your anxiety may be due to an underlying medication, an underlying medical condition if you don't have any blood relatives with an anxiety disorder, if you didn't have an anxiety disorder as a child, if you don't avoid certain things or situations because of anxiety, or you have a sudden occurrence of anxiety that seems unrelated to life events, and you didn't have a previous history of anxiety, it may be because of that underlying medical condition. Let's go over risk factors. Trauma. Trauma is a big risk factor. So, especially if you're a child and you've endured abuse, your home life's not good, things like that. As I talked about with a student of mine, stress due to an illness, stress buildup. Personalities, people with certain personality types are more prone to anxiety disorders, other mental health disorders, having blood relatives with an anxiety disorder. So I do know of somebody who their parent suffered from an anxiety disorder and they committed suicide, which I'll get into the complications later of an anxiety disorder, and suicide is one of them, but their parent committed suicide. So they had an anxiety disorder, so having blood relatives with an anxiety disorder is a big risk factor, as well as trauma. So because the parent had an anxiety disorder, they had a blood relative, which increases the risk, and the trauma of the parent committing suicide is a big risk factor. So their child now suffers from a severe anxiety disorder. Drugs or alcohol and other mental health disorders are also risk factors. Let's go into complications. So depression is a complication. Substance misuse. A lot of people might abuse drugs, alcohol, if they have an anxiety disorder, something that they might use to help try to get rid of this pain that they're going through, that they're suffering from. Digestive or bowel problems, headaches and chronic pain, social isolation. This is a big one. They might not want to go out. They might want to stay in their room. They might not want to leave their house. Problems functioning at school, at work, poor quality of life, and suicide. These are all complications of anxiety disorders.